Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. It's a pleasure to be here with Dr. Melissa Hankins. Dr. Hankins is the CEO and founder of Melissa Hankins Coaching, a coaching and consulting firm that is committed to helping physicians and leaders overcome burnout and helping organizations create and maintain psychologically safe work environments and sustainable well-being for their employees. Dr. Hankins is an executive certified coach, Harvard-trained psychiatrist, and tapping practitioner. In addition to leading her own organization, Dr. Hankins serves as faculty for the Academy of Creative Coaching, an ICF-accredited coach training organization. She is also a contributing author for the best-selling book, Thriving After Burnout, a compilation of real stories by female physicians. Melissa, it's such an honor to have you here.
Oh, I am so grateful to be here. Thank you so much for inviting me, Jessica.
I'd love to know if you could share your story and interest, your passion for working with trauma, becoming a psychiatrist, and then all the extra work you've done.
My path to trauma, being more trauma aware and trauma informed, it's not where I started off. However, it makes sense to me because I've always been a lifelong learner, but also having a lifelong interest in understanding why human beings do the things that we do. So that's from childhood on. As I have understood things more throughout my journey as a psychiatrist and certainly as a coach, just understanding the impact that trauma has on our behaviors, whether it's more obvious trauma, the big traumas that we often think of that have historically been labeled like big T traumas, the kind of abuse or war or car accidents, these life-threatening type of things, or the kind of what have been historically called little T traumas. So things that aren't necessarily a threat to life, but really do impact our day-to-day living and existing and interactions with ourselves and with others. So really having that awareness that behaviors are something that are developed as an answer to solve a problem that we have as human beings. And oftentimes, if someone has a trauma, the behavior that results is about trying to maintain safety, first and foremost. That if there's a lot of emotion that is occurring at the time that behavior is developing, then it's really going to be anchored into kind of the blueprint for, okay, if I have this kind of similar situation occurring in the future or what have you, this is something that we are going to pull up as our blueprint automatically. It's not even a thought. That's really interested me. And I think just speaking to my own personal journey and experience, I'm someone who has had a significant amount of trauma in my life, but I never focused on that. But understanding kind of later hurdles that I've had, I can look back and say, okay, well, that came from this. And just trying to understand myself more, especially as a coach, because we don't really get that in medical school. We do not become self-aware. That is not the focus in any way, shape, or form. It is all about being focused on care for the patient, but through a lens of pathology, not a lens so much of empowerment and self-awareness for the patient or certainly for ourselves. For me, I was always a different kind of psychiatrist anyway. I came to psychiatry. It was not the first thing I thought I was going to do in medicine. I was going to be an internal medicine doc, but I fell in love with psychiatry. And I fell in love with psychiatry because it was I always looked at it as a gift that people would give to me, that they would share their innermost thoughts and feelings and fears. It took so much courage, and I really honored that. I was always, while I love biology and the mind body and energy connection, especially with EFT now, and that's always been present, in terms of psychiatry, medication was not the focus for me. As an MD, that's where organizations tend to point us. I was always looking at bringing in things into psychiatry that were things like mindfulness, and those are much more common. When I was practicing clinically, that was not the case, but I was bringing in these types of things into my work with patients, and always kind of considered myself more of a coach psychiatrist anyway. When I was pregnant with my son, something told me I didn't want to stay in medicine forever. So I became certified as an executive coach. And that was at a time when coaching was very focused on corporate coaching. There wasn't much in the way of health coaching. There wasn't much in the way of even life coaching, at least where I was. I was in the Boston area in a Harvard institution, and this was not something that we heard about. And so it was something that I wanted to be able to use some of my skills in creating safe spaces for my patients, my future coaching clients, and being able to have a space where they could be more self-aware and empowered. And I thought, okay, well, where can I do this? And coaching, a friend of mine, a psychologist colleague of mine, was going through a certification program or had registered for it and told me about it. I said, hey, that sounds good. Let me try that. So that's kind of how I found my way into coaching.
I just want to pause and acknowledge everything that you've shared. Thank you so much. There's so much in everything that you've said that resonates. What you said about medical school, them not teaching us. We learned trauma from psychiatry, just coming from emergency medicine. It always astounded me. Trauma resuscitations, trauma codes. You can stand in front of a room in front of so many people when someone is dying. But when it comes to actually processing your own, like you said, I didn't realize the impact of that either until I had transitioned careers and started learning about mind-body medicine. It's interesting that you said when you were pregnant, you got the message that you wanted to take another route, because all the foundation that you have in medicine with the coaching and the other techniques you have, mind-body techniques, I feel like this is medicine because you also get to the root.
Absolutely. That always drove me crazy in psychiatry, no pun intended. But just the focus was, okay, let's treat, and so much of medicine as a whole, treat symptoms. And it's like, well, why is the person having symptoms in the first place? What is going on? Really, if we're trying to create true transformation for someone, helping someone to create that within themselves rather than just constantly chasing, okay, well, this is what's coming up. Oh, and it's like whack-a-mole. So being able to help our patients as a physician or clients as a coach, it's really helping our clients look at what role can they play in their own well-being. And it's much larger than most people might think. It is not something that, yes, don't get me wrong, there's an absolute role for physicians. However, the agency that we have as human beings to create our own well-being, and we may need a guide along that path, and that's where coaching certainly comes in. That is something to be encouraged. That's really where my heart lies. And I think with the idea of trauma, I went through my own burnout, crashed and burned as a physician. And what I mean by that is I was, like many of us, I was considered a superstar. My colleagues loved me. I was getting great outcomes with my patients. I was pursued by different organizations to come and work there. I was appointed by my organization to the Board of Registration of Medicine. I was nominated and appointed by the governor of Massachusetts to be on that. I was being known for what I did and my knowledge base, and yet I think when my son was 4, it was becoming more and more apparent to me that I just couldn't keep up with everything that I needed to be doing. And this was before burnout became a thing. Burnout was not acknowledged in the world of medicine. There was a day after my son's 4th birthday, celebrated, and then the next day I was getting ready for work, and I had the thought that my son would be better off without me, because I'm just not present. I'm not showing up. I'm always working. I'm bringing charting home. I'm not present for him in the way that I want to be. And if I was trying to be physically present, it's because I was pushing everything else until the wee hours of the morning and getting less and less and less sleep. Really, it came down to that point where I couldn't do it anymore. And I had told my supervisor that I needed to take an immediate medical leave. I mean, he knew I was kind of struggling, and he was saying, okay, can you come in and see your patients for the next couple of days? Because we have no place to put them, no one can see them. And of course, being the well conditioned physician that I am or was, I said, okay, all right, because I didn't want to be a burden, place any burden on my patients or my colleagues. And the next day, I was getting ready to try to go into work, and I had my first and only major panic attack. Could not get dressed, could not leave the house, was just a wreck. I was just sobbing. I was saying, I can't come in. I just cannot I can't even get dressed. I can't leave my house. And they said, okay. After I hung up the phone, I still had to get my son ready to go to school. He was in Montessori at the time. And after about 20 minutes, I was able to calm down and go. And I realized I could go and see his ice skating lessons. And it was his last day of ice skating lessons. And I had missed them all because of work. And I was so heartbroken. And I could go, and I went fully present. Had a wonderful time, no anxiety, no panic, nothing. And I realized when I got home and I would try to go near my work computer, I started to get anxious again. But aside from that, I was okay. So it was really I had this conditioned response at that point to work and things associated with work. And I can begin to see that link for myself in that experience, how my trauma around work was impacting me. During that time, I thought I was going to be out for a couple of weeks, ended up being out for 10 months before I resigned from that job. And during that time, I really was focused more on I did some therapy. I did a lot of EFT and worked with someone with EFT and emotional freedom techniques or tapping. I did a lot of yoga and just kind of mind body practices and meditation and mindfulness practices and coaching, and just really had this combination of pouring into me for the first time ever.
I love that phrase, pouring into me. There's so many connections on personal levels and professional levels. There's so much harmony and like full circle coming. Thank you again for so candidly sharing. It's so brave, and I know it helps so many people just by sharing. I know one of the things you had mentioned was how coaching's been around for a long time, but as you mentioned, first it's sports coaching, and then when it got into the corporate world, it was executive coaching. And even the National Board for Health and Wellness Coaching is more recent in popular recognition. And so, given the recent innovations, recent trends, recent growing credentialing body, obviously it's important for physicians and patients to be aware of trauma, but it's also so important for coaches to be aware of trauma. And so I'd love for you to, if we could have you speak on that, on how it's important, because one of the things I realized was, so the National Board for Health and Wellness Coaching has done a tremendous job. There are more than 10,000 coaches certified, and it's a great process. It's a good standard. It helps. But one of the backgrounds is an associate's degree or higher, or 4,000 hours of work experience. And so there's so much variation in the health coach. They may be healthcare provider backgrounds or they may not. So everyone's trauma experience completely varies. And then, like you mentioned, there's our own personal experiences of trauma, from like adverse childhood experiences to PTSD and our awareness of that. So all of that in context, I'd love to hear your perspective on how coaches, why they need to be aware of trauma and how can they.
Right, absolutely. Thank you so much for highlighting all of those points. With trauma is a condition of being human. Every human being on the planet has experienced some level of trauma. Simply by going through the pandemic, we have experienced trauma. But even when we look at trauma, one of the definitions that I use that's very simple and easy to, I think, for most people to relate to and to remember is things that are experienced as too much too fast, too much too soon, too much for too long, or too little for too long. So when we look at our experiences through kind of that filter, or our clients' experiences through that filter, that can be very individualized because it has a lot to do with what is your nervous system capable of processing. When you get to a certain threshold, and that is dependent on each person's individualized experience. If you had a similar experience, you might not experience it as traumatic because your threshold and your lens is going to be different. One of the things that's really important to understand is that an experience of trauma is individualized by definition, and that it is not the event itself, but how we respond to the event. So that's really important. And our ability to respond to an event will depend on our resources, our internal resources and our external resources. And external resources can be things like people in your life, your financial status, certain tools and skills and knowledge that you have that you might not have had at some other point in your life. Internal resources could be all of the mind chatter and self-critical and lack of compassion and lack of self-compassion, lack of self-forgiveness. And the more that we can work on that and work on that with, say, coaches or through therapy or the self work that we do, the more that we can become aware of that and stop it before the train really goes down the track and derails us. The more that we can not necessarily not experience trauma, but if it shows up in ways, we have ways to manage it. Then, as we are able to better calm our nervous systems and have a sense of safety and a sense of security, because that's bottom line. It's this sense of safety, and whether or not that is rational or not, it is our experience or it's your client's experience. So understanding that as a coach is very important, because when you understand that maybe this person is having this behavior, sometimes coaches may feel like, oh, this client is just kind of resisting the coaching. They're not following through. They say they're going to do this and they make this agreement and this plan and they're not doing it. And so as a coach, you might get frustrated, and certainly your client is going to get frustrated with themselves or with the coaching. Having that understanding that, okay, wait, despite you saying you want to change this behavior and even taking some action in that, you're not shifting in the ways that we're working towards. There must be something else that's holding it back. Is there a lack of safety that is being experienced in some way with the thought of creating this change? Is there something that may have happened in the past that is being activated, those feelings, that sense of, oh, I need to protect myself, this isn't a safe thing for me to be doing for whatever reason, is that being activated. And it's not as a coach that you're going to go and delve deeply into that. You're not a therapist. You're not playing the role of therapist. But having that awareness, if your client divulges something, it can help create that, oh, okay, I get it now. I understand where this comes from. And even having that level of awareness can often help a client begin to, and you as a coach can help them work through, okay, this is actually a separate thing. I am not back in this. I have many more resources now at my disposal, including coaching, that I may not have had back then. I have different tools in my toolbox that I can use to help me move forward. Just having that awareness can create that compassion that a client can feel for themselves, saying, wow, okay, I get where this comes from. All right. Okay, maybe I can stop being so hard on myself. And when you can create that space, that's when you can start to create change.
It sounds like, and please forgive me if I'm misunderstanding, but what I'm hearing is you so beautifully basically said that trauma informed coaching is having that awareness of how trauma impacts us at a human level in our coaching interactions. And like you said, it's not delving deep and working through past. That's what you refer to a therapist or a psychiatrist for. If someone's emotionally distressed or obviously needs more professional help, we have to know when to refer. That is our scope of practice. But it sounds like the trauma awareness is key for having this expanded lens, like you so beautifully mentioned, expanded lens to get to help support someone move forward. And so I'd love to know, sometimes, or more commonly I see now, and it has a long way to go, obviously, of coaches, trauma-informed coaches working with therapists and working side by side as a team. But it's just so important, I think, for all of those roles, especially as coaches, to recognize what their scope of practice is versus what the scope of practice is of the therapist or the psychiatrist.
Yes. The world of coaching sometimes has backlash around just hearing the word trauma. They're like, oh no, don't, no, 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 trauma. No. As soon as you say that, the wall comes down. It's like, no, no, we don't do that here. And my thought is, hey, you're working with human beings. You're working with trauma, plain and simple. People do not leave their traumas at the door when they come in to work with you. When they come into a session, they bring their whole self. And so that's part of the package. As you said, it's so important to understand, okay, this is my scope, this is my lane, my scope of practice is here, and the scope of practice of a licensed mental health professional, psychiatrist, therapist, psychologist, what have you, is over here. You might find this in areas of health and wellness coaching where people are, maybe they're struggling with their weight or their eating habits or their sleep or managing stress and, all of these things. You might be more likely to hear a client reveal, oh yeah, well, I've been having this my whole life, this happened, and boom, out drops a trauma. And you're like, oh, okay, what do I do with that? Because you want to maintain the rapport. So you don't want to shut your client down completely, but you need to understand how to create boundaries in a way that still maintains empathy and those lines of trust and communication and safe space. Delving into a trauma and opening it up is not safe. That is not a safe container. You can re-traumatize someone that way. But certainly the idea for coaches to understand something about trauma, my edict is really, the more that you know, the less harm that you can do. And so if you have awareness of trauma that, okay, this is what it might look like, this is how it might present, is there a way to use this in service of the coaching? while also helping a client get referred to a mental health professional if that needs to be the case. And when would that need to be the case? And that's part of understanding the path of being trauma aware as a coach and trauma informed. There is a slight difference. Being trauma aware is understanding the impact of trauma, that trauma is part of the human condition and that it's going to impact behaviors and thought patterns and possibly create hidden challenges, if you will, in the coaching progress. Whereas trauma informed includes being trauma aware, but also incorporating practices into your business, for example, as a coach that helps your clients not be traumatized even getting connected with you. It might be looking at the kind of questionnaire you have. If you have like a screening questionnaire or something like that for your clients, what types of questions are you asking? Are those potentially things that could be triggering or activating a trauma? And so that's just an initial procedure or policy that you have. How are you discussing the work that you do with them? If you're working in an organization, how is the organization putting things in place to help clients? If you're an internal coach, for example, or partnering with a clinic or something along those lines, what kind of policies do they have in place that are being more inclusive and creating a space of safety from the moment a client contacts you?
Thank you for clarifying that, because trauma awareness versus trauma informed coaching, these are all words that we sometimes see now thrown around, and they're important to know and understand. It's still, I think, in its newer phase in terms of education and standardization of education. And so I'm really grateful to have you here for your work that you're doing and to also clarify these important distinctions for coaches who are also looking to either become trauma aware or trauma informed. Even finding a resource sometimes is a little bit tricky, at least at the time of this recording. There's no national coaching credentialing body that has standards. So there are certain places in place that offer trauma informed coaching for coaches and certification, and some of them are run by healthcare providers. I've also seen some that aren't. And so, as coaches look for where to learn these things, it's really important to just really be mindful of also who's teaching. And so again, grateful to you and for your work and for helping to share awareness with all the rich background that you have to help people.
Thank you. Yes, you are so correct. Much like all kind of modalities, there has to be a beginning. We are in the infancy of having more trauma-informed spaces, but having this awareness, first of all, it all starts with awareness, with acknowledgement that, hey, this is an actual thing. While there isn't the kind of standardized and credentialing kind of process, say a body, a national body or an international body of like trauma informed practices, there are places that can help you or where you can get information. There are a couple of books that are now available about trauma and coaching. There's one here called Coaching and Trauma: From Surviving to Thriving, and it's by Julia Vaughn Smith. So that's what this one looks like. And then there's the Trauma Informed Coach by Joanna Harper. As you said, there are resources that are led by physicians. There are some mental health professionals, and there are some that aren't, but maybe they have been very much delving into different resources around understanding how trauma impacts the mind and the body and behaviors. And so you do need to be careful in vetting, and it's tricky. It's a field in its infancy, and with the lack of mental health resources that are available, not just in the United States, but worldwide, and the need far outpaces the availability of licensed mental health professionals at this point in time. And I don't see that changing anytime soon with the amount of chaos that the world has been experiencing for the past number of years, and it just seems to be getting louder. As coaches, we might be the first point of entry for many of our clients who are revealing that they have a trauma. And so, for us as coaches to have at least some basic awareness of that and not just get so activated ourselves. So it's not just understanding that for our clients, but understanding it for ourselves. And if you have a trauma history as a coach, it's so important to do your own work and work with someone, whether it's another coach, whether it's a therapist, whether it's working with an EFT practitioner. All of these things help you not only develop greater self-awareness, but help to regulate your emotional state, to help you regulate your responses, to understand if you're sitting with a client and they reveal something and it might be similar to an experience you've had that you may have experienced as traumatizing, even if your client doesn't experience it as traumatizing. How do you stay present in the room with them to actually provide the coaching and not go back into your own kind of trauma response? So, being aware of these things is really important for us to be more present and create bigger and safer containers for the coaching to actually occur and to help our clients move forward. So, my thought is, and I certainly believe all coaches need to have some awareness of trauma. It just makes you a better coach, and it can help you create better outcomes for your clients.
It's such a beautiful way to drive this home. And because, in terms of takeaway messages for listeners, for coaches, or healthcare providers listening to this, what comes to me after everything you've said is really driving in that point from the beginning. You were talking about agency, just as human beings. And whether it's health and wellness coaches or an executive coach, any type of coach, it's so important for them to have that trauma informed awareness, because specifically with health and wellness coaches, but then it becomes a part of advocacy to help bridge those gaps in our healthcare system. You had talked about there being a increased demand and decreased supply of providers, and that's true for mental health, especially, as far as every other field that I know of. And so realizing that there is such a big gap from a public health standpoint on the role of coaching to educate is so important. I love that. The more you know, the less harm you can do. Our goal is to do no harm and to help support people, to help get them to the right place. And so my takeaway is so important to understand that trauma awareness as a coach.
Yes. And it can help you to feel more confident and safer as a coach, because it can help you to recognize, oh, okay, this is, even if you don't address it directly, you just have it in the back of your head. Okay, this is maybe what could be going on, and it may impact the line of questioning that you ask with your clients. And it can also help you to feel more confident in, okay, well, how can all right, I need to have some tools to help them regulate their emotions, because that can come up first and foremost. I need to help them if they reveal a trauma. I need to keep them present in this room with me and not back in the trauma. And then once you're doing that, then you can help them look at, okay, well, this isn't the place for us to unpack and explore this. That's not a safe thing to do. That is to be done with a mental health professional. And it's important for all coaches to have a referral resource list and things like that. So really, to have places to refer to help our clients, how can we utilize that and help them move forward without re-traumatizing them, and acknowledging that, hey, thank you for sharing this with me. That took a lot of courage. I know that that was difficult, and I'm not dismissing it. I just need to help you get to the right place to unpack it if that's what you choose to do. And we can do this part of work around. I can help you maybe learn to regulate your emotions around it, or some of the thoughts that come up in the present day that might be impeding you. Maybe that's how I, as a coach, can help you to move forward, even if this trauma is impacting you in some way in your present. So being able to understand that and say that confidently to clients can be really impactful for your confidence as a coach and for your client's confidence in you as a coach.
So beautifully stated. Thank you so much for sharing your light and your wisdom, and again, for all the work that you're doing.
Yes. Oh, thank you so much. This has just been such a pleasure to have this time with you, to speak with you. Thank you for inviting me. I'm very grateful, and for the work that you're doing and bringing people like me in to talk about things that will help all of us as coaches, as physicians, and help our patients and our clients to live better lives.
Thank you for listening. I appreciate you and value your feedback, so please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.